OpenAI has just unveiled a feature that invites users to share their most private data, medical records, with an AI chatbot. The decision arrives without fanfare, yet it positions the company at the intersection of convenience and vulnerability, where a simple query about lab results could expose years of health history to algorithmic interpretation. We know this much. The feature, embedded as a separate tab within ChatGPT, allows users to connect their electronic health records and wellness trackers directly to the system. It pulls in data from platforms like Apple Health for sleep patterns and heart rates, or from apps tracking diet and exercise. Once linked, the AI can parse lab results, suggest workout routines, or even draft questions for a doctor's visit. It's built on a model refined with input from hundreds of physicians across specialties, using a benchmark dataset designed to evaluate medical responses. Availability starts with a waitlist for beta testers, expanding soon to all users, though notably excluding Europe and the UK for now. Privacy measures include isolated storage for health chats, added encryption layers, and a policy against using this data to train broader AI models. Users can delete histories or disconnect apps at any time. Critically, it's not meant for diagnosis or treatment. OpenAI stresses this repeatedly, positioning it as an informational tool only. What's notable here is the proactive element. The system detects health-related questions in the main chat and nudges users toward this dedicated space, almost as if anticipating their needs before they fully articulate them. The integration goes beyond mere advice, incorporating partnerships like one with a clinical data platform that connects to millions of providers, or even linking meal plans to grocery orders, blending everyday utility with sensitive information in a way that feels seamless. This move aligns with OpenAI's pattern of incremental expansion, starting from general chat to specialized tools that leverage user data for personalization. Recall how the company has navigated past controversies, from data breaches that exposed user conversations to policy updates barring unlicensed advice. Here, by creating a sandboxed environment for health queries, they're addressing those risks head-on. Health queries already flood the platform, with millions turning to it weekly, especially in underserved areas where access to professionals is limited. OpenAI captures a market that's been wary for big tech. Companies have historically shied away from personal health records due to liability concerns. Yet OpenAI presses forward, collaborating with medical experts, not just for accuracy, but likely to build a defensible layer against future scrutiny. The emphasis on non-HIPAA compliance underscores this. It's framed as a consumer product, sidestepping stricter medical regulations while still delving into clinical territory. Short sentences for emphasis. It's bold, it's calculated, and it relies on user trust in an era of eroding privacy norms. The mental health angle adds another layer. The system handles such topics as part of general wellness, tuned to respond informatively without alarm, directing users in distress toward professionals or resources. This reflects broader industry patterns, where AI fills gaps in care availability, but it also echoes past missteps, incidents where chatbots have given harmful advice, leading to real-world consequences. OpenAI's executives describe it as an ally in health management, yet the setup encourages data sharing that could reveal intimate patterns over time. Why this now? Perhaps because de-identified data shows a surge in off-hours queries from rural users, signaling untapped demand. Or maybe it's a strategic pivot amid competition, turning a free tool into something indispensable, even as it normalizes AI's role in personal decisions.